So anything about quality of touch that we need to go back on? Cool. And then the last thing that we talked about yesterday during the lecture portion was contraindications. They're all pretty self-explanatory. Local injuries, if something's recently locally injured, especially if they say things like, well, I don't really trust doctors, don't work on that person. Just don't do it. You never know what you're dealing with underneath the surface, and as great as you can be at anatomical assessment and as many different tools as you might have in terms of orthopedic testing, you never know what's happening if somebody is showing signs of an acute injury. So for 72 hours after an injury, pretty much don't touch it unless you're cleared by a doctor to do so. And that's something I had to fight working at a chiropractic office, because we were a very busy office, and as competent as the office manager was, things would slip through the cracks. And every once in a while you get somebody who's scheduled in for your time, and they walk in and the doctor, either they haven't had an x-ray or an MRI, or the doctor hasn't seen it and read the radiology report, or whatever's happening. You need to be the one to stop and say, this is a dangerous situation for you. It's not that I don't want to work on you, it's that I'm not qualified to tell you that it's okay for me to work on you. Know your limits, know your scope of practice. So local injuries, especially if there's any kind of broken tissue or major swelling or bruising, inflammation, those warning signs. If it looks angry, don't touch it. And then we talked about some systemic things. Things like, obviously, fever. The body's already fighting a war inside. It doesn't need any other, third combatant jumping into the ring. Just let it do what it's doing, because it's already in a positive feedback loop of trying to kill some infection or some disease in the body. And so the last thing it needs is for us to go in and offer it more toxins released from the tissues or physical challenges that it's not able to overcome. So be aware if somebody is presenting with a noticeable fever. And that includes other signs of it, things like sweating, inappropriate clothing, hot, cold, clamminess, all of that stuff. Medications, always keep an eye on medications, especially, blood thinners can cause a risk. Anything relating to blood pressure, you want to know why they're on it and what their normal is, and make them aware that especially deeper work can elevate the blood pressure or cause fluctuations in blood pressure. We never want to do harm to someone who's coming to us for help. People who, are diabetic, we need to be careful, because not only are there blood sugar issues, not only is there a homeostatic issue there's also neurological damage. They may not understand the damage that you're doing to their tissues, especially in the extremities, which goes back to what you were talking about with working over the joints and that kind of thing. If somebody's compromised neurologically, maybe don't go ham on their hands and feet. Just pay attention to what's happening and what that person's dealing with. And then the last major point in systemic issues would be an extreme state of exhaustion or deficiency. Most of the time at the point that it's really damaging to somebody, you're not going to see them. But anything from overexertion at a sporting event, if you're doing sports massage and they're just in a position where their body does not need any further challenge, or especially not deep tissue, you might be able to do some restorative, therapeutic, soft touch work to help regulate the body again and bring it back out of that fight mode that we're naturally in at a sporting event. Be aware of people who are presenting with signs of things like eating disorders, malnutrition, any kind of deficiency, decay, exhaustion of the body. Dehydration is a big one, because we move water through the body with massage therapy. So we want to be aware of any exaggerated state of the body, essentially. And then the last thing we talked about, we reserved it specially because it can be either local or systemic, and a lot of the science is still out in terms of how we affect different forms of it, but cancer. Cancer specifically, any other issue like that where the common knowledge says one thing and the science is kind of mixed reviews, we want to be very, very aware of. get a doctor's written approval before you work on somebody who's in active treatment for cancer. Know what you can about the type of cancer that they're dealing with. Do your research. Be okay with telling them, "I'm sorry, not today." And then, they can fight it out with their doctor if they don't like that. But protect yourself and protect the person, because a lot of times people come to us wanting some kind of relief, and they don't understand that we could be doing further damage. So again, do no harm.